I'm 26. Okay, this sounds so stupid. I don't know why I'm crying.
Hi, Jenna. I'm Katie. I'm a board certified dermatology nurse practitioner, and I came across your video and it broke my heart a little bit. I see patients every day that come into me in a similar place that you are, and I just first and foremost want to say you're not stupid, you're not being materialistic or silly. Hair loss is a very real and stressful and frustrating condition, and unfortunately, there's not a quick fix, and it leaves patients, especially women, the thought of when your hair starts to come out, everyone's worst fear is that, like, am I going to lose all my hair? Like, is this going to just continue? Hair loss, even if it's not noticeable to someone else who doesn't see you every day, is still hair loss. And I listened to a speaker, I wish I could remember this dermatologist's name, but he said something that has always stuck with me as a provider. And he said that in order for me as a provider to appreciate a patient's hair loss, not knowing them at baseline, they would have had to lose 50% of their hair in order for me as a provider to be like, wow, yeah, like I totally see what you mean. So I really hope the GYN dermatologist that you're going to doesn't minimize your just the mental anguish that this is causing, because hair loss is very stressful. And guess what? Stress can cause hair loss. There's a lot of different reasons for hair loss. I'm not here to come on and diagnose you or tell you exactly what to do. You're doing all the right things. You're getting your labs checked. I've had patients, I've been that patient. I've struggled with hair loss myself as a patient. You're almost praying for your labs to be off. You're praying for your thyroid to be off so that someone's like, you know what? Your thyroid's off. We're going to give you this medicine, or you're going to have to do this, and everything's going to go back to normal. And I think what's the most frustrating for patients who suffer with hair loss is when they leave an appointment and their doctor's like, everything looks great. And you leave and everything's not great. Your hair is coming out in clumps and the problem is not solved. I definitely think Nutrafol is good that you're on it. I would be curious to know how long you've been on it, because it definitely is something that I tell patients you really have to stay on for at least 6 months to be able to kind of appreciate any sort of improvement. And beyond 6 months, if my patients don't see improvement, I don't keep them on the medication. Another product that has come out in the last, I want to say, year or two is a product called Stress Adaptogen that you can take with your Nutrafol, and it's for patients that are going through what we call a telogen effluvium, which is where your hair gets kind of stuck in that falling out phase, and it's a good kind of supplemental product. That's something you could look into. Doing your labs is going to be very important just to check that box. There's lots of different options as far as regrowing hair of things you can do. There's PRP injections, there's exosomes, there's TED, which is a device that grows hair. But before you delve into all those things, before you spend your hard-earned money on some of these treatments, you want to make sure that you've checked all the boxes. So you're doing all the right things. Try not to beat yourself up. Don't be kind to yourself. When your hair is coming out, it is very stressful. It is not superficial or materialistic to say that you're in tears about your hair. I do this for a living. I have a board certification as a nurse practitioner in dermatology, and when it was happening to me, it's just like all that goes out the window. I was just like you. I was in tears. I was worried, is my hair ever going to come back again? Is it ever going to feel the same? All of your feelings are valid. Keep going on the journey that you're on. Do not give up. I hope that you find a provider that can help you, and definitely keep us posted.